Established in 2010, Chipembere Community Development Organization (CCDO), a rural-based local youth-led organization in Choro District, Malawi, was set out to empower the youth, young women, girls and children to voice out issues that affect them on their daily lives. However, sexual reproductive health and rights (SRHR) of the youths, especially adolescent girls in Cholo, remain a challenge due to a number of factors ranging from lack of information on comprehensive sexual and reproductive health and rights due to deep-rooted customs and harmful traditional practices. With support from HEVOS through the regional SRHR Fund, CCDO embarked on a project dubbed SRHR Access among rural adolescent girls in Cholo District.
There's a problem to do with the adolescent girls, whereby most of the times these girls, they don't have knowledge about how they can go on the issues to do with the sexuality. You find that a lot of girls are getting pregnancies and they're going into early marriages. Most of them is because of our cultural practices and the lack of where they can get a lot of information regarding sexual reproductive health and rights.
Through this project, CCDO ensured the meaningful participation of girls and boys, women and men to ensure that they equally participate in all project activities. The project empowered women and girls to voice out issues that affect them, engaged key stakeholders in resolving the social and economic challenges, and increased literacy levels, especially among women and girls who are more vulnerable to social inclusion.
With this project, we have managed to reach a lot of youth, a lot of girls who dropped out of school, a lot of girls who are just staying idle in the community. We have encouraged a number of youth to engage in different income-generating activities. And we also taught many of the youth about sexual reproductive health and rights. So many of our girls and young people are aware of their sexual rights. For example, they are able to report any sexual harassment to the relevant authorities, for example, to the police, to the health centers, and even if it is here at school, they are reporting to us whatever they are experiencing at home and even in the community.
Another teacher, Matilda Mpinji of Ligoe Catholic Primary School in the same Cholo district, says youths in the community surrounding the school have greatly benefited from the project, and this has been made possible with the composition of sexual reproductive health clubs in schools.
At first, the community had an alarming rate of sexual abuse, which includes rape and also sexual harassment. But the state has changed due to the composition of the sexual reproductive youth clubs. As of now, the youth are able to know where to access friendly health services, and at the same time, their communication with their parents, mainly on sexuality, has improved.
Empowering of youth through various trainings including SRHR and human rights trainings improved youth participation in various aspects of sexual reproductive health programs and increased their understanding about their entitlements on issues of SRHR. Tayali Youth Club is one such organization which benefited from the trainings that CCDO offered to the youths. The club, which has a membership of 50, comprising 20 boys and 30 girls aged between 10 to 25 years, were equipped with knowledge and skills to mentor fellow youths on SRHR and human rights.
As a youth leader, we meet as a group. When we met, we totally discuss about this sexual reproductive health, health rights in a way that we will talk more about how youths can say no to some harmful cultural practices, how are going to seek some advices, and where and to who are they supposed to go and seek some advices. This, I think, is an important issue because it has impacts on its own. Yeah, because there is behavior change that we have seen during this project. There is a reduction of early marriages.
Sub-Inspector Diston Sitima is Community Policing and Victim Support Unit Coordinator for Vombwe Police Station in Cholo. He commends the project for helping to sensitize the community, especially the youths, on the need to report SRHR abuses to the police.
That this project will have assisted us for many ways. We have received a lot of girls here complaining about their abuses, and sometimes they're able to come with their views on us. How can we assist those girls? I would like this project to continue. Maybe they can give us time guidelines of how to assist those girls.
For Birilani Kaunda, nurse, midwife technician and youth-friendly nurse provider at Vombwe Health Center, says the facility has so far assisted more than 200 youths with services like family planning, sexual transmitted infection clinic, and sometimes they conduct cervical cancer screenings, thanks to the project which has assisted to sensitize the communities and the adolescent girls.
Actually, this project has helped us a lot. We have at least helped more than 200 youth. They actually come for Vombwe Health Center for youth-friendly health services. We provide services like family planning, STI clinic, HTS, and sometimes we offer cervical cancer testing. This program should continue because many youth are being helped at our facility.
But what has been the role of traditional leaders in the project? Watson Kumbala is the chairperson of Sub-Traditional Authority Magis Area Development Committee, ADC.
Tikayerekeza kuti ngati dziko pakali panopo tikudalira chinyamatawo. Ndifake apapa kwambiri timakoza ngati mabylaws oti anakonzedwa ndithu okhazikika kuti nomwina nkhale kholo ngati lingolekera mwana kupezeka ni mimba mose nthawi kesana kone bwino ndiye amayenera kupereka mbuzi chifukwa choti akatero ndiye kuti akupha chituwo cha dera lathu. Nyamatawa ndi amene angazatigwira manja amene kutukula dziko lino.
According to Linda Malima, Monitoring and Evaluation Officer for CCDO, the project was characterized with some challenges, including the emergence of COVID-19, which derailed some of the project work plan.
Another challenge has been the COVID-19 pandemic because we were having a limited time to discuss issues whenever we have meetings. We are looking forward then to have the project extended so that we can have others access to services by introducing one-stop center within the community so that we can ease the access to SRHR services.
Meanwhile, CCDO plans to venture into mental health programs as a way of sustaining the project and at the same time curb sexual gender-based violence, SGBV.